perfect. It only has 2 buttons and the backup t-shirt, so this should go really well. Right, when I was first approached to talk here, I must have been like dead tired because, you know, asked to talk about anything I felt really passionate about. Why would I choose to talk about fatigue, sleep deprivation, and being totally exhausted? I mean, it's not sexy, is it? Well, this might explain it. Like several of you in the audience, I was doing 24-hour shifts every other day and sleeping on average maybe about 3.5 hours. Now, don't get me wrong, I like to think I am a warrior, right? I can take it. I'm a Navy SEAL who needs sleep anyway. But as I get older, and maybe a little bit wiser, I'm starting to reflect on my own life. And I'm starting to realize that there is a bit of a dark side. You see this force? The dark side to this medical culture that we live in. And maybe, while we're trying to save other people's lives, we are busy killing ourselves. Because you know what? Fatigue kills. No, you say, I've been doing this for 20 years. I am bulletproof. I don't suffer these sort of things. That's for the weak, those who can't take it. I think you'll find if you are part of the human species, you too need sleep to survive, even more than you need Wi-Fi. And it is, in fact, not the weak who suffer from these things. It is the type A, the go-getters, those who always do more than what's expected of them, who stay behind, who thinks the next job is a big job. These are the kind of people that will suffer from fatigue and burnout. Notice anyone in this audience that resembles someone like that? Now, the Mayo Clinic has looked into this, and they found that the doctors most at risk for suffering from fatigue and burnout are the critical care doctors and the emergency medicine doctors. Now, combine that with frontline work, sitting in the EMS office, being bored, and then suddenly having to be fully awake, not eating well, not sleeping well, and you have a perfect storm for having this workforce that is totally sleep-deprived and fatigued. Hands up, the honest ones. Who has ever fallen asleep driving home on their way after a shift? Or drove into your driveway and you're not quite exactly sure how you got here? Or how many traffic signals you actually stopped at or didn't stop at? You see, driving when you're tired is as dangerous as driving when you're drunk or speeding. And there are some of our colleagues who have died on the roads driving back home asleep. Fatigue kills, not just our patients, but we are also at risk of making more medical errors, being involved in safety-compromising behavior, and even if we don't kill our patients, we are at risk of killing ourselves. And we do stupid things with people's lives in our hands. You know, and people have studied this. This is a great study looking at really tired anesthesiology residents, putting them in a driving simulator after they've worked for 6 consecutive night shifts. Do you know what? Their response times is 20 times slower, 10 to 20 times slower. And they're more at risk of crashing the cars. But it's not just the poor anesthesiologists, emergency physicians. Those of you who've done your homework that I sent out would have got some of these articles to read. I think it's time that we wake up, because fatigue might be the #1 problem facing all of us. And maybe if there were more dramatic car crashes and planes falling out of the sky, we would take this seriously. But we do live in a little bit of a physician and a paramedic superhero culture, don't we? And even if there aren't big crashes, the consequences of sleep deprivation are extraordinary, and here are just some of them. Your risk of getting cancer increases by 4 times, to such a degree where the WHO has considered classifying shift work as a carcinogen. You're at risk of developing obesity, depression. You start lacking compassion and can suffer compassion fatigue. Your immune system suffers. You have a risk of getting diabetes, and you become ugly. You know, when you don't get your beauty sleep, this is all true. Your collagen gets broken down, and you will get more wrinkles. You also become stupid. And you lose insight into what you do. And you don't realize how stupid you are getting. You have a 4 times increase in all-cause mortality over the next decade compared with your friends and colleagues who sleep more than 6 hours a night. How scary is that? Increased risk of heart attacks, strokes, hypertension, arrhythmias, weakness, inability to deal with stress. You become mean and angry all the time. It steals your creativity and wipes your mind. You have risk of early onset Alzheimer's if you get less than 6 hours of sleep a night. And while you're missing your precious sleep, you are not being a superhero. You are slowly turning into Jabba the Hutt. It is fatal. And although you might look super hot, burning the midnight oil, on fire, what you're actually doing is burning out. And we all know how things look after they've burned out. You're formless, hopeless, exposed to the elements, a shadow of your former self. So are there any solutions? Well, there's no one size fits all. But the first way of defeating an enemy is to know that there is an enemy and that you are in a fight, not only for your patients' lives, but for your own life. And then we have to change this tough guy, medical superhero mentality that we have and realize we are part of the human race that needs to rest. It's time that we help ourselves to help our patients. You know, it's not cool being a walking zombie. You won't say to a pilot, boy, you look like death warmed up. Hey, let's go flying. We have to take breaks. It has to be acceptable. And when there's quiet times at work, take a nap. NASA found that if pilots nap before landing, their attention is actually better. We have to look after ourselves and our team to be able to look after our patients. How are you doing? How's your team doing? Are you seeing how fatigued they are? Are you measuring it? Do you have fatigue policies that you are implementing? It's time to realize that you are in a battle. Fight back. Wake up and go to sleep.